Question 1. Upon reviewing the Six Sigma project management documentation for a new medical device manufacturing process improvement, which approach would an auditor prioritize to ensure compliance with the U.S. regulatory framework for biomedical products? Option A. Verifying that the Six Sigma project successfully achieved its defined statistical targets for process variation reduction and cycle time improvement, as outlined in the project charter. Option B. Confirming that the Six Sigma project was executed within the allocated budget and timeline, and that all project team members were adequately trained in Six Sigma methodologies. Option C. Assessing whether the Six Sigma project's scope and deliverables are aligned with the organization's overall quality management system and demonstrably contribute to meeting the requirements of the Quality System Regulation, 21 CFR Part 820, with a focus on patient safety and product efficacy. Option D. Evaluating the project's impact on overall operational efficiency and cost savings, as measured by key performance indicators established by the Six Sigma Black Belt leading the project. The correct answer is A. Verifying that the Six Sigma project successfully achieved its defined statistical targets for process variation reduction and cycle time improvement, as outlined in the project charter. Explanation. This scenario is professionally challenging because auditing Six Sigma project management requires an auditor to assess not only the adherence to Six Sigma methodologies, but also the alignment of these projects with broader organizational quality objectives and regulatory compliance within the biomedical sector. The auditor must balance the technical rigor of Six Sigma with the critical need for patient safety and product efficacy, which are paramount in this industry. Careful judgment is required to determine if the project management processes, while potentially effective in achieving Six Sigma metrics, are also ensuring that the biomedical products or processes being improved meet all applicable regulatory standards and do not introduce new risks. The correct approach involves evaluating the Six Sigma project's alignment with established quality management systems and regulatory requirements, such as those mandated by the FDA, assuming U.S. jurisdiction for this exam. This means verifying that the project's scope, objectives, and deliverables are consistent with the organization's overall quality policy, and that the project's outcomes demonstrably contribute to compliance with regulations like the Quality System Regulation, 21 CFR Part 820. The auditor must confirm that the project management processes incorporate risk assessment and mitigation strategies relevant to biomedical product development and manufacturing, ensuring that improvements do not inadvertently compromise safety or effectiveness. This approach is ethically and regulatorily justified because it directly addresses the auditor's responsibility to ensure that quality initiatives within a biomedical organization uphold patient safety and regulatory compliance, which are the foundational principles of biomedical auditing. An incorrect approach that focuses solely on the statistical efficiency of Six Sigma tools without considering their impact on regulatory compliance is professionally unacceptable. This failure stems from neglecting the primary mandate of a biomedical auditor, which is to ensure that quality improvements do not jeopardize patient safety or violate regulatory mandates. For instance, if a Six Sigma project streamlines a manufacturing process but inadvertently bypasses a critical quality control step required by 21 CFR Part 820, the auditor's oversight would be deficient. Another incorrect approach that prioritizes project completion within Six Sigma timelines and budget over the thorough validation of the project's impact on product quality and safety is also professionally flawed. This approach demonstrates a misunderstanding of the auditor's role, which is not merely to assess project execution, but to ensure the integrity of the outcomes for the end user and the organization's compliance. A project completed on time, but resulting in a non-compliant product or process, fails to meet the fundamental objectives of quality assurance in the biomedical field. The professional decision-making process for similar situations should involve a risk-based approach. Auditors must first identify the critical regulatory requirements and quality objectives relevant to the biomedical product or process under review. They should then assess how the Six Sigma project management processes and their outcomes interact with these critical elements. The focus should always be on whether the project's improvements enhance or maintain compliance and patient safety, rather than solely on the project's adherence to Six Sigma's internal metrics. This requires a deep understanding of both Six Sigma principles and the specific regulatory landscape governing biomedical products. Question 2. Stakeholder feedback indicates a desire to streamline the manufacturing process for a Class Roman II medical device to reduce lead times and associated costs. As a certified biomedical auditor, which approach would you recommend to address this feedback while ensuring continued regulatory compliance and product quality? Option A. Conduct a comprehensive process mapping and analysis to identify specific areas of inefficiency, followed by the development and validation of targeted process improvements that demonstrably maintain or enhance product quality and safety in alignment with CGMP and relevant ISO standards. Option B. Implement changes based on industry best practices observed in similar device manufacturing, without specific validation for this particular device's manufacturing process. Option C. Focus solely on accelerating the existing workflow without a thorough assessment of the impact on critical quality attributes or regulatory requirements, based on the assumption that the current process has historically met standards. Option D. Immediately implement proposed cost-saving measures suggested by stakeholders, prioritizing speed and cost reduction over detailed process review, assuming current processes are adequate. The correct answer is A. Conduct a comprehensive process mapping and analysis to identify specific areas of inefficiency, followed by the development and validation of targeted process improvements that demonstrably maintain or enhance product quality and safety, in alignment with CGMP and relevant ISO standards. Explanation. This scenario is professionally challenging because it requires balancing the need for efficiency and cost reduction with the imperative to maintain the quality and safety of biomedical devices, as mandated by regulatory bodies. Auditors must exercise careful judgment to identify genuine process improvements that do not compromise compliance or patient safety. The correct approach involves a systematic review of existing processes, identifying bottlenecks or inefficiencies, and proposing data-driven, evidence-based modifications that align with current good manufacturing practices, CGMP, and relevant ISO standards. This approach prioritizes a thorough understanding of the current state before implementing changes, ensuring that any optimization is validated and does not introduce new risks. Regulatory justification stems from the fundamental principles of quality management systems, which require continuous improvement while maintaining control and compliance. For example, FDA Regulations E.g. 21 CFR Part 820 emphasize the need for processes to be validated and controlled, and any changes must be managed through a formal change control process to ensure they do not adversely affect the device's safety or effectiveness. An incorrect approach of immediately implementing cost-saving measures without a comprehensive impact assessment would be professionally unacceptable. This fails to adhere to the principle of risk management, a cornerstone of medical device regulation. Such an approach could lead to the introduction of non-validated processes, potentially compromising device quality and patient safety, thereby violating regulatory requirements for process validation and control. Another incorrect approach of focusing solely on stakeholder requests for speed without verifying the impact on quality would also be a failure. While stakeholder satisfaction is important, it cannot supersede regulatory compliance and patient safety. This approach neglects the auditor's responsibility to ensure that all processes meet established quality and safety standards, potentially leading to noncompliance with regulations that mandate robust quality systems. A further incorrect approach of relying on anecdotal evidence or past practices without current validation would be similarly unacceptable. Regulatory frameworks require that processes be demonstrably effective and compliant at the time of use. Relying on outdated or unverified information can lead to the implementation of suboptimal or non-compliant processes, risking regulatory scrutiny and potential product recalls. The professional reasoning process for similar situations should involve a structured approach. First, thoroughly understand the current process and its regulatory context. Second, gather objective data and evidence to identify areas for improvement. Third, evaluate potential changes for their impact on quality, safety, and regulatory compliance. Fourth, propose and document changes through a formal change control process, including validation and verification. Finally, monitor the implemented changes to ensure sustained effectiveness and compliance. This systematic and evidence-based methodology ensures that process optimization efforts are both beneficial and compliant. Question 3. Market research demonstrates that a medical device manufacturer is proposing to implement a new, potentially more efficient, manufacturing process for an existing product. The manufacturer's internal team has conducted preliminary testing and assumes the new process will yield a product with equivalent or superior quality attributes. As a certified biomedical auditor, which approach would be most appropriate to validate this assumption in accordance with regulatory requirements? Option A. Recommend the implementation of a highly complex, multivariate statistical model that requires specialized external expertise to analyze the data, regardless of its direct relevance to the core assumption. Option B. Review the manufacturer's internal validation report without independently verifying the statistical methodology or the underlying data. Option C. Accept the manufacturer's internal qualitative assessment and anecdotal evidence from a small number of initial production runs as sufficient validation. Option D. Utilize hypothesis testing to statistically analyze data from a representative sample of products manufactured under the new process to determine if there is a statistically significant difference in key quality attributes compared to the established process. The correct answer is D. Utilize hypothesis testing to statistically analyze data from a representative sample of products manufactured under the new process to determine if there is a statistically significant difference in key quality attributes compared to the established process. Explanation: this scenario is professionally challenging because it requires a biomedical auditor to balance the need for efficient resource allocation with the imperative of ensuring product safety and regulatory compliance. The auditor must validate assumptions about a new manufacturing process without compromising the integrity of the audit or the potential for identifying critical deviations. The core challenge lies in selecting a statistical approach that is both scientifically sound and demonstrably compliant with the relevant regulatory framework for biomedical devices. The correct approach involves using hypothesis testing to statistically validate the assumption that the new manufacturing process yields a product with equivalent or improved quality characteristics compared to the established process. This is justified by regulatory requirements that mandate robust validation of manufacturing processes for medical devices. Specifically, regulatory bodies like the U.S. Food and Drug Administration, FDA, under 21 CFR Part 820, Quality System Regulation, require manufacturers to validate processes where the results cannot be fully verified by subsequent inspection and test. Hypothesis testing provides an objective, data-driven method to demonstrate this validation, ensuring that the null hypothesis, no difference or worse performance, can be rejected in favor of the alternative hypothesis, improved or equivalent performance. This aligns with the auditor's responsibility to ensure that processes are validated and that product quality is maintained or enhanced, thereby protecting patient safety and meeting regulatory expectations for process control. An incorrect approach would be to rely solely on anecdotal evidence or qualitative observations from a limited number of production runs. This fails to meet the statistical rigor demanded by regulatory frameworks for process validation. Such an approach would not provide objective evidence of process equivalence or improvement, leaving the audit vulnerable to findings of noncompliance with validation requirements. It also introduces a high risk of overlooking subtle but significant process variations that could impact product quality and patient safety. Another incorrect approach would be to implement a complex, resource-intensive statistical test that is not directly relevant to the specific assumptions being validated, or that requires specialized expertise beyond the scope of a standard biomedical audit. While statistical rigor is important, the chosen method must be appropriate for the data and the question being asked. Overly complex or irrelevant tests can lead to misinterpretation of results, wasted resources, and potentially obscure critical findings, thereby failing to effectively validate the process assumption in a practical and compliant manner. A further incorrect approach would be to accept the manufacturer's internal validation study without independent auditor review or reevaluation of the underlying statistical methodology. While internal studies are a starting point, an auditor's role is to provide an independent assessment. Failing to critically examine the statistical validity of the manufacturer's assumptions and testing methods would represent a failure to perform a thorough audit and could allow non-compliant processes to go undetected. The professional decision-making process for similar situations should involve a clear understanding of the regulatory requirements for process validation. The auditor should first identify the specific assumptions being made about the new process. Then, they should determine the appropriate statistical methodology that can objectively test these assumptions, ensuring it aligns with the principles of hypothesis testing and the data available. The auditor must then critically evaluate the chosen statistical test for its relevance, interpretability, and ability to provide sufficient evidence to support or refute the assumption, all within the context of regulatory compliance and patient safety. Question 4. Examination of the data shows a consistent trend of minor delays in the final assembly stage of a critical medical device, leading to increased overtime costs. Management is considering implementing a comprehensive lean manufacturing initiative to streamline operations and reduce waste, with a strong emphasis on rapid process changes and cost savings. Simultaneously, proposal has been made to conduct targeted Kaizen events in the assembly area to address specific bottlenecks identified in recent quality control reports. As the certified biomedical auditor, which approach best aligns with regulatory requirements and ensures continued patient safety. Option A. Implement targeted Kaizen events focused on specific, documented bottlenecks, ensuring all changes are validated and documented according to regulatory standards, while simultaneously assessing the broader lean initiative for phased, risk-assessed integration. Option B. Prioritize cost reduction through lean principles by identifying and eliminating any steps in the assembly process that appear to add minimal value, without extensive validation, to quickly achieve financial targets. Option C. Conduct Kaizen events to rapidly implement changes in the assembly area, bypassing formal change control procedures to expedite improvements and reduce delays. Option D. Immediately implement the comprehensive lean manufacturing initiative across all departments to achieve maximum efficiency gains and cost reductions, assuming that streamlining processes will inherently improve quality and safety. The correct answer is A. Implement targeted Kaizen events focused on specific, documented bottlenecks, ensuring all changes are validated and documented according to regulatory standards, while simultaneously assessing the broader lean initiative for phased, risk-assessed integration. Explanation. This scenario is professionally challenging because it requires the certified biomedical auditor to balance the drive for efficiency and quality improvement with strict adherence to regulatory requirements and patient safety. The auditor must critically evaluate proposed methodologies, ensuring they align with the established regulatory framework for biomedical devices, which prioritizes patient well-being and device efficacy above all else. A superficial understanding or misapplication of continuous improvement principles could lead to unintended consequences, jeopardizing compliance and patient care. The correct approach involves implementing Kaizen events focused on specific, identified areas of inefficiency or potential risk within the biomedical device manufacturing process, while rigorously ensuring that all changes are validated and documented according to regulatory standards. Kaizen, with its emphasis on small, incremental, and continuous improvements involving all personnel, is well suited to refining existing processes without introducing significant disruption or noncompliance. This aligns with regulatory expectations for robust quality management systems that foster ongoing improvement while maintaining control and traceability. The regulatory justification lies in the principles of good manufacturing practices, GMP, and relevant ISO standards, e.g., ISO 13485, which mandate documented procedures, change control, and validation of any process modifications to ensure consistent product quality and safety. An incorrect approach would be to adopt a broad, unvalidated lean implementation across all departments without a thorough risk assessment and phased integration. This could lead to the premature elimination of critical quality control steps or documentation processes that are mandated by regulations, thereby increasing the risk of non-compliance and potential patient harm. Regulatory failure here is the disregard for the validation requirements inherent in any process change within a regulated industry. Another incorrect approach would be to prioritize cost reduction through lean principles without adequately assessing the impact on device quality and safety. This could result in cutting corners on essential testing or material specifications, directly violating regulatory mandates for product integrity and patient safety. The ethical failure is the prioritization of financial gain over patient well-being. A third incorrect approach would be to implement Kaizen events that bypass established change control procedures. While Kaizen encourages rapid improvement, in a regulated environment, even minor changes must be formally documented, assessed for impact, and approved to maintain regulatory compliance and auditability. The regulatory failure is the circumvention of documented change management processes, which are fundamental to maintaining a compliant quality system. The professional decision-making process for similar situations involves a systematic evaluation of any proposed improvement methodology against the specific regulatory requirements of the biomedical device industry. This includes understanding the core principles of the methodology, assessing its potential impact on product quality, safety, and regulatory compliance, and ensuring that any implementation is phased, validated, and thoroughly documented. Auditors must act as a critical check, ensuring that the pursuit of efficiency does not compromise the fundamental obligations to patient safety and regulatory adherence. Question 5. Assessment of how a certified biomedical auditor should verify that Six Sigma roles, including champions, master black belts, green belts, and yellow belts, are effectively integrated into the organization's quality management system to ensure ongoing regulatory compliance with applicable U.S. frameworks, such as the FDA's Quality System Regulation. Option A. The auditor should focus on the number of Six Sigma projects completed and the reported efficiency improvements, assuming that successful process optimization inherently leads to regulatory compliance. Option B. The auditor should confirm that Six Sigma project charters clearly define the regulatory compliance objectives and deliverables for each role, and that project documentation and outcomes are reviewed for adherence to relevant U.S. regulatory requirements. Option C. The auditor should assess Six Sigma roles independently of the established quality management system, focusing only on the application of Six Sigma tools and methodologies. Option D. The auditor should rely solely on the Six Sigma certifications of individuals in these roles to ensure they possess the necessary understanding of regulatory compliance. The correct answer is B. The auditor should confirm that Six Sigma project charters clearly define the regulatory compliance objectives and deliverables for each role, and that project documentation and outcomes are reviewed for adherence to relevant U.S. regulatory requirements. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified biomedical auditor to navigate the complex interplay between Six Sigma methodologies, which are process improvement frameworks, and the stringent regulatory compliance requirements inherent in the biomedical industry. The auditor must ensure that the implementation and execution of Six Sigma roles and responsibilities do not inadvertently lead to deviations from established good manufacturing practices, GMP, quality management system, QMS, requirements, or other applicable regulations. Misinterpreting or misapplying these roles can result in non-compliance, impacting product quality, patient safety, and regulatory standing. Careful judgment is required to balance the drive for efficiency with the non-negotiable demands of regulatory adherence. Correct approach analysis. The correct approach involves the certified biomedical auditor verifying that the champion, master black belt, green belt, and yellow belt roles are clearly defined within the organization's QMS, and that their responsibilities align with regulatory expectations for quality and compliance. This includes ensuring that champions provide strategic direction and resources for Six Sigma initiatives, while upholding regulatory standards. Master black belts and black belts lead complex improvement projects with a focus on compliance, and green belts and yellow belts execute improvements at the operational level, always within the bounds of regulatory requirements. The auditor must confirm that these roles are empowered to identify and address compliance gaps within their projects, and that their activities are documented in accordance with regulatory expectations. This approach is justified by the fundamental principle of regulatory compliance, which mandates that all quality-related activities, including process improvement initiatives, must be conducted in a manner that meets or exceeds the requirements of bodies such as the FDA in the U.S. context, assuming this is the specified jurisdiction for the exam. Incorrect approaches analysis. An approach that focuses solely on the efficiency gains or cost reductions promised by Six Sigma without explicitly integrating regulatory compliance checks into the project scope and execution, is incorrect. This failure stems from neglecting the primary mandate of a biomedical auditor to ensure adherence to regulations. Such an approach risks overlooking critical compliance issues that may arise during process improvements, leading to potential regulatory violations. Another incorrect approach would be to assume that Six Sigma certifications alone guarantee regulatory compliance. While certifications indicate proficiency in Six Sigma methodology, they do not inherently confer knowledge of specific biomedical regulations or the auditor's responsibility to verify their application. This oversight can lead to a false sense of security regarding compliance. Furthermore, an approach that allows Six Sigma roles to operate in isolation from the established QMS without clear integration and oversight is also incorrect. This can create a shadow system where improvements are made without proper validation, documentation, or risk assessment, all of which are critical regulatory requirements. This disconnect undermines the integrity of the QMS and increases the risk of noncompliance. Professional reasoning. Professionals should employ a risk-based approach, prioritizing areas where Six Sigma initiatives could impact product quality, patient safety, or regulatory compliance. This involves understanding the specific regulatory landscape applicable to the biomedical products and processes under review. When assessing Six Sigma roles, the auditor should ask, how does this role's activity contribute to or potentially detract from our regulatory compliance obligations? This question guides the auditor to scrutinize project charters, methodologies, documentation, and outcomes for adherence to GMP, QSR, quality system regulation, and other relevant standards. The decision-making process should involve cross-referencing Six Sigma project plans with regulatory requirements and ensuring that all personnel involved understand their compliance responsibilities within their Six Sigma roles. Question 6. Which approach would be most effective for a certified biomedical auditor to recommend for addressing a recurring, minor performance deviation in a Class Roman II medical device, ensuring both process optimization and regulatory compliance? Option A. Relying on the experience of senior technicians to implement ad hoc adjustments to the manufacturing process. Option B. Initiating immediate corrective actions based on the most recent occurrence of the deviation without a formal root cause analysis. Option C. Implementing a Plan-Do-Check Act (PDCA) cycle to systematically identify the root cause, test solutions, verify effectiveness, and standardize improvements. Option D. Documenting the deviation and waiting for a significant number of similar occurrences before initiating a formal investigation. The correct answer is C. Implementing a Plan-Do-Check Act (PDCA) cycle to systematically identify the root cause, test solutions, verify effectiveness, and standardize improvements. Explanation. This scenario is professionally challenging because it requires a biomedical auditor to balance the need for continuous improvement with the strict adherence to regulatory requirements for medical device quality management systems. The auditor must identify a systematic approach to address a recurring issue in a device's performance, ensuring that any proposed solution is not only effective, but also compliant with the relevant regulatory framework. The challenge lies in selecting an approach that is robust, data-driven, and demonstrably leads to sustained improvement, rather than a superficial fix. The correct approach involves a structured, iterative process that systematically identifies the root cause of the recurring performance issue, implements a solution, verifies its effectiveness, and then standardizes the improvement. This aligns directly with the principles of process optimization and is fundamental to maintaining a compliant and effective quality management system, QMS, as mandated by regulatory bodies. Specifically, this approach embodies the Plan-Do-Check Act (PDCA) cycle, a cornerstone of quality improvement methodologies recognized and often implicitly or explicitly required by regulatory frameworks governing medical devices. The PDCA cycle provides a systematic framework for problem-solving and continuous improvement, ensuring that changes are well-planned, implemented, evaluated, and then integrated into standard operating procedures. This methodical process is essential for demonstrating to regulators that the organization is proactively managing risks and ensuring the safety and effectiveness of its medical devices. An incorrect approach that focuses solely on immediate problem containment without investigating the underlying cause fails to address the systemic nature of the issue. This can lead to recurring problems, increased risk to patient safety, and potential noncompliance with regulations that require root cause analysis and corrective actions. Another incorrect approach that involves implementing changes based on anecdotal evidence or assumptions, rather than data, lacks the rigor required for regulatory compliance. Such an approach risks introducing new problems or failing to solve the original one, demonstrating a lack of systematic control over the QMS. Furthermore, an approach that bypasses the verification and standardization stages of improvement, moving directly to new initiatives without confirming the effectiveness and embedding the changes, undermines the principle of continuous improvement and can lead to a regression of quality standards. Professional decision-making in such situations requires a thorough understanding of the QMS, regulatory expectations, and quality improvement methodologies. Auditors should always prioritize approaches that are data-driven, systematic, and aligned with established quality principles like PDCA. This involves critically evaluating proposed solutions against regulatory requirements for corrective and preventive actions, COPPA, risk management, and overall QMS effectiveness. The goal is to ensure that improvements are sustainable, verifiable, and contribute to the overall safety and performance of the medical device. Question 7. Implementation of a new sterile processing workflow for a medical device manufacturer has resulted in a process map that highlights a significant deviation from the validated sterilization parameters for a critical device. The Auditor, a senior manager, suggests that the process map be adjusted to reflect the intended process rather than the observed process, arguing that the observed deviations are minor and will be corrected in the next cycle. As a certified biomedical auditor operating under US FDA regulations, what is the most appropriate course of action? Option A. Create a separate, informal note documenting the observed deviation, but do not include it in the formal process map or audit report, as it is a minor issue. Option B. Document the observed process map accurately. Clearly identify the deviation from validated sterilization parameters, and report this finding with specific reference to the relevant FDA regulations, e.g., 21 CFR Part 820. Option C. Adjust the process map to reflect the intended process as described by the Auditor, noting that the observed deviations are minor and will be corrected. Option D. Omit the specific details of the deviation from the process map and focus on other aspects of the workflow to avoid creating unnecessary conflict. The correct answer is B. Document the observed process map accurately, clearly identify the deviation from validated sterilization parameters, and report this finding with specific reference to the relevant FDA regulations e.g., 21 CFR Part 820. Explanation. This scenario presents a professional challenge due to the inherent conflict between the auditor's duty to ensure regulatory compliance and the potential for interpersonal conflict or perceived obstruction by the Auditor. The auditor must navigate this delicate balance while upholding the integrity of the audit process and adhering to established standards. Process mapping and flowcharting are critical tools for visualizing complex workflows, identifying deviations from intended processes, and pinpointing areas of noncompliance. The ethical dilemma arises when the identified noncompliance, visualized through the process map, directly implicates individuals or departments who may resist or attempt to downplay the findings. The correct approach involves meticulously documenting the current state process as observed, accurately reflecting all steps, decision points, and inputs/outputs. This documented process map then serves as the objective basis for identifying deviations from established standard operating procedures, SOP, or regulatory requirements. When discrepancies are found, the auditor must clearly and factually present these findings, referencing the specific regulatory framework, e.g., FDA regulations for medical devices in the U.S., and the documented process map. This approach is ethically sound and professionally justifiable because it relies on objective evidence and adherence to established regulatory mandates, ensuring patient safety and product quality. It upholds the auditor's responsibility to identify and report noncompliance without bias or personal agenda. An incorrect approach would be to alter the process map to align with the auditor's desired outcome, or to omit critical steps that highlight noncompliance. This is ethically unacceptable as it constitutes falsification of audit evidence and a dereliction of the auditor's duty to report accurately. It violates the principles of integrity and objectivity fundamental to auditing. Furthermore, failing to document the observed process accurately, and instead relying on anecdotal evidence or assumptions about how a process should be run is also professionally unsound. This approach lacks the rigor required for a credible audit and can lead to missed critical findings or the incorrect identification of issues. It undermines the reliability of the audit report and can have serious consequences for patient safety and regulatory standing. Professionals should employ a decision-making framework that prioritizes objectivity, evidence-based findings, and adherence to regulatory requirements. This involves 1. Thoroughly understanding the relevant regulatory framework and the intended processes. 2. Meticulously observing and documenting the actual processes, creating an accurate process map. 3. Objectively comparing the documented process map against regulatory requirements and SOPs. 4. Clearly and factually communicating any identified deviations, supported by the process map and relevant regulations. 5. Maintaining professional skepticism and resisting any pressure to alter findings. Question 8. The performance metrics show a significant increase in the time taken to approve new medical device packaging and labeling designs due to extensive review cycles. To optimize this process, a proposal suggests streamlining the review by focusing primarily on material cost savings and visual appeal, assuming that existing labeling content is generally adequate and packaging integrity is a secondary concern, unless visually obvious damage is present. Option A. Approve the proposed streamlining of the review process, prioritizing material cost savings and visual appeal, with a reduced emphasis on detailed content verification and packaging integrity checks to expedite market entry. Option B. Delegate the primary responsibility for packaging and labeling review to the marketing department, as they are best positioned to assess visual appeal and cost-effectiveness, with minimal oversight from the quality assurance team. Option C. Conduct a comprehensive review of the proposed packaging and labeling changes against the U.S. FDA's 21 CFR Part 801 and relevant GMP requirements, ensuring all critical information and protective qualities are maintained, and then implement targeted improvements to the review process based on identified bottlenecks. Option D. Implement a phased approach where initial approval focuses on cost and aesthetics, with a subsequent, less rigorous review for labeling content and packaging integrity conducted post-market release. The correct answer is C. Conduct a comprehensive review of the proposed packaging and labeling changes against the U.S. FDA's 21 CFR Part 801 and relevant GMP requirements, ensuring all critical information and protective qualities are maintained, and then implement targeted improvements to the review process based on identified bottlenecks. Explanation: this scenario is professionally challenging because it requires a biomedical auditor to balance the need for efficient process optimization with the absolute, non-negotiable requirement for regulatory compliance in medical device packaging and labeling. Errors in this area can lead to patient harm, product recalls, and significant legal and financial repercussions for the manufacturer. The auditor must possess a deep understanding of the relevant regulatory framework to identify deviations and recommend corrective actions that uphold patient safety and product integrity. The correct approach involves a thorough review of the proposed packaging and labeling changes against the specific requirements of the applicable regulatory framework, such as the U.S. Food and Drug Administration, FDA regulations for medical devices. This includes verifying that all labeling elements, such as device identification, manufacturer information, warnings, precautions, and instructions for use, are accurate, complete, and compliant with 21 CFR Part 801. Furthermore, the auditor must assess if the proposed packaging design adequately protects the device from damage or contamination during transport and storage, and if it facilitates proper handling and use, aligning with good manufacturing practices, GMP principles. The regulatory justification lies in the FDA's mandate to ensure that medical devices are safe and effective, and that users have the necessary information to use them correctly. An incorrect approach that focuses solely on cost reduction without a comprehensive regulatory review would fail to identify potential non-compliance issues. For instance, simplifying labeling to reduce printing costs might inadvertently omit critical warnings or instructions, violating 21 CFR 801. 5. Which mandates that labeling contain adequate directions for use. Another incorrect approach that prioritizes speed of implementation over thoroughness could lead to the approval of packaging that does not adequately protect the device, potentially compromising its sterility or functionality, which is a violation of GMP requirements for device quality and safety. A third incorrect approach that relies on historical practices without verifying current regulatory applicability would be negligent, as regulations evolve, and past compliance does not guarantee future compliance. Professionals should employ a systematic decision-making process that begins with clearly identifying the specific regulatory requirements applicable to the medical device and its intended market. This involves consulting the relevant regulatory guidance documents and standards. Next, they should evaluate proposed process changes against these requirements, using a risk-based approach to prioritize potential areas of noncompliance. Documentation is crucial. All reviews, findings, and recommendations should be meticulously recorded. Finally, open communication with the manufacturer's quality and regulatory affairs departments is essential to ensure understanding and facilitate effective implementation of corrective actions. Question 9. During the evaluation of a batch of critical diagnostic imaging devices nearing their scheduled release date, the biomedical auditor discovers several minor deviations from the approved manufacturing process specifications. The engineering team asserts that these deviations are inconsequential and do not affect device performance or safety, and they are requesting the auditor to approve the immediate release of the batch to meet urgent market demand. What is the most appropriate course of action for the biomedical auditor to ensure compliance with quality management principles and regulatory expectations? Option A. Initiate a formal deviation investigation and risk assessment process to document the nature of the deviations, evaluate their potential impact on device safety and efficacy, and determine if compensatory actions or post-market surveillance are necessary before approving release. Option B. Halt the release of the batch indefinitely until all deviations are rectified to perfectly match the original specifications, regardless of their potential impact. Option C. Forward the deviations to the regulatory authority for their direct assessment and decision on batch release. Option D. Approve the immediate release of the batch based on the engineering team's assurance that the deviations are minor and do not impact performance or safety to meet urgent market demand. The correct answer is A. Initiate a formal deviation investigation and risk assessment process to document the nature of the deviations, evaluate their potential impact on device safety and efficacy, and determine if compensatory actions or post-market surveillance are necessary before approving release. Explanation. This scenario presents a professional challenge due to the inherent conflict between the immediate need for a critical medical device and the auditor's responsibility to ensure compliance with established quality management systems and regulatory requirements. The pressure to expedite the release of a device that may have deviations requires careful judgment to balance patient safety, regulatory adherence, and organizational efficiency. The correct approach involves a thorough risk assessment and a documented deviation management process. This entails evaluating the potential impact of the identified deviations on the device's safety, efficacy, and performance. If the deviations are deemed minor and do not compromise these critical aspects, a formal deviation report should be generated, detailing the nature of the deviations, the rationale for their acceptance, and any proposed compensatory actions or post-market surveillance. This process aligns with the principles of good manufacturing practices, GMP, and the Quality Management System, QMS, framework, which mandate a systematic approach to managing nonconformities and ensuring that product quality is not compromised. Regulatory bodies, such as the FDA in the U.S., expect robust deviation management to be in place. An incorrect approach would be to release the device without a formal deviation assessment, relying solely on the engineering team's verbal assurance. This bypasses the established QMS procedures and regulatory requirements for documenting and approving deviations. It creates a significant regulatory risk, as it demonstrates a failure to adhere to documented procedures and a lack of objective evidence to support the decision to release the product. This could lead to regulatory noncompliance, product recalls, and potential harm to patients. Another incorrect approach would be to halt the release indefinitely due to minor deviations without a proper risk assessment. While caution is important, an overly conservative stance that impedes the availability of a necessary medical device without a clear and documented justification based on a thorough risk assessment can also be professionally problematic. It fails to apply the principles of risk-based decision-making inherent in modern quality systems. The professional reasoning process should involve 1. Understanding the specific regulatory requirements and the organization's QMS for deviation management. 2. Collaborating with relevant stakeholders, e.g., engineering, quality assurance, regulatory affairs, to gather all necessary information about the deviations. 3. Conducting a comprehensive risk assessment to determine the potential impact on patient safety and device performance. 4. Documenting the findings and the decision-making process in accordance with established procedures. 5. Ensuring that any decision to release the device with deviations is supported by objective evidence and appropriate approvals. Question 10. The efficiency study reveals that a critical manufacturing process for a Class Roman II medical device is exhibiting variability. The process capability indices have been calculated. Which approach best reflects the auditor's responsibility to ensure the process consistently produces conforming product in accordance with U.S. FDA quality system regulation requirements? Option A. Rely primarily on CP and CPK, assuming that short-term capability is sufficient for regulatory compliance. Option B. Assess CPK and PPK, as these indices account for process centering and reflect actual long-term performance against specification limits. Option C. Ignore the process capability indices and focus only on the overall yield percentage of the process. Option D. Focus solely on CP and PP to determine the theoretical potential of the process to meet specification limits. The correct answer is D. Focus solely on CP and PP to determine the theoretical potential of the process to meet specification limits. Explanation. The efficiency study reveals that a critical manufacturing process for a Class Roman II medical device is exhibiting variability. As a certified biomedical auditor, the challenge lies in interpreting the process capability indices, CP, CPK, PP, PPK, to determine if the process is meeting established specifications and regulatory requirements, particularly concerning patient safety and product efficacy. This requires a nuanced understanding of the difference between short-term potential and long-term actual process performance and their implications for compliance. The correct approach involves assessing both potential and actual process capability. This means understanding that CP and PP measure the potential spread of the process relative to the specification limits, assuming the process is centered. CPK and PPK, however, account for process centering and provide a more realistic measure of how well the process is performing in reality, considering both spread and location relative to the specification limits. For regulatory compliance, especially under frameworks like the U.S. FDA's Quality System Regulation, 21 CFR Part 820, demonstrating that processes are capable of consistently producing conforming product is paramount. Therefore, focusing on CPK and PPK, which reflect actual performance, is crucial for determining if the process is under control and capable of meeting design and manufacturing specifications, thereby ensuring product safety and effectiveness. An incorrect approach would be to solely rely on CP or PP. While these indices indicate the theoretical capability if the process were perfectly centered, they do not reflect the actual performance of the process as it operates. If a process has a high CP but a low CPK, it suggests the process has the potential to be capable, but is currently misaligned with the target, leading to a higher risk of producing non-conforming product. Relying only on potential capability without considering actual performance would be a failure to adequately assess risk and ensure compliance with the regulatory requirement to maintain processes in a state of control. Another incorrect approach is to ignore the distinction between short-term and long-term indices. CP and CPK are typically calculated using data from a single subgroup or a short period, representing potential capability. PP and PPK use data from the entire production run, representing actual long-term capability. A process might appear capable based on short-term data, CP, CPK, but reveal significant issues when considering long-term performance, PP, PPK, due to shifts or drifts. Failing to consider the long-term perspective would lead to an incomplete and potentially misleading assessment of process stability and capability, risking the release of non-conforming product. The professional decision-making process should involve 1. Understanding the specific regulatory requirements for process validation and control for the device class. 2. Differentiating between potential and actual process capability indices. 3. prioritizing the assessment of actual capability (PPK) and CPK as they reflect real-world performance. 4. Investigating any significant differences between short-term and long-term indices to identify root causes of variability or shifts. 5. Using this comprehensive understanding to determine if the process is capable of consistently meeting specifications and to identify any necessary corrective actions to ensure product quality and patient safety. Question 11. Performance analysis shows a significant number of deviations reported in the last quarter related to product assembly. As a certified biomedical auditor tasked with assessing the effectiveness of the quality management system, QMS, documentation, which approach would best identify the root cause of these deviations and ensure compliance with U.S. FDA regulations? Option A. Systematically audit the documented quality manual, standard operating procedures, SOP for assembly, and specific work instructions for the affected product lines, followed by direct observation of the assembly process and interviews with assembly line personnel. Option B. Focus on reviewing all completed assembly batch records and deviation reports from the last quarter to identify trends in reported issues. Option C. Request a presentation from the engineering department on the design specifications of the affected products and compare them to the reported assembly deviations. Option D. Conduct a thorough review of the organization's quality manual, then interview key personnel in the quality assurance department to confirm their understanding of the QMS. The correct answer is D. Conduct a thorough review of the organization's quality manual, then interview key personnel in the quality assurance department to confirm their understanding of the QMS. Explanation. Scenario analysis. This scenario presents a common implementation challenge in regulated industries, ensuring that documented quality management system, QMS, elements, specifically quality manuals, procedures, and work instruction, accurately reflect actual practices and are consistently followed. The challenge lies in the potential disconnect between the written word and the reality on the ground, which can lead to non-compliance, product defects, and ultimately, patient harm. Auditors must exercise careful judgment to identify these discrepancies and assess their impact on the overall effectiveness of the QMS. Correct approach analysis. The correct approach involves a systematic review of the QMS documentation, including the quality manual, standard operating procedures (SOP), and work instructions, and then validating these documents against actual observed practices and employee interviews. This approach is correct because it directly addresses the core requirement of regulatory compliance and QMS effectiveness. For a certified biomedical auditor operating under U.S. regulations, e.g., FDA 21 CFR Part 820 Quality System Regulation, the quality manual establishes the overall QMS framework, while SOPs detail how specific activities are performed, and work instructions provide step-by-step guidance for critical tasks. The auditor's role is to verify that these documented processes are not only in place, but are also being followed consistently and effectively. This validation ensures that the organization's QMS is robust, compliant, and supports the consistent production of safe and effective medical devices. Incorrect approaches analysis, an approach that focuses solely on reviewing the quality manual and assuming all downstream procedures and instructions are compliant, is incorrect because it fails to validate the actual implementation of the QMS. The quality manual is a high-level document. Its existence does not guarantee that detailed procedures and work instructions are accurate, up-to-date, or being followed. This oversight can lead to the identification of significant compliance gaps during an inspection. An approach that prioritizes interviewing a few senior managers about their understanding of the QMS without observing actual work practices or reviewing detailed documentation is also incorrect. While management commitment is crucial, their understanding may not reflect the day-to-day realities of operational staff. This approach risks overlooking critical deviations occurring at the operational level, which are often the source of non-compliance. An approach that exclusively examines completed forms and records without verifying the underlying procedures or work instructions that generated them is insufficient. While records provide evidence of past activities, they do not explain how those activities were performed or whether they adhered to established QMS requirements. This can lead to a false sense of security if the records are flawed due to non-compliant processes. Professional reasoning. When faced with implementing QMS documentation, a certified biomedical auditor should adopt a risk-based, evidence-driven approach. This involves 1. Understanding the documented QMS structure, reviewing the quality manual to grasp the overall system. 2. Deep dive into procedural documentation, examining SOPs and work instructions relevant to the audit scope. 3. On-site verification, observing actual work practices and comparing them to documented procedures. 4. Employee interviews, engaging with personnel at all levels to confirm understanding and adherence. 5. Record review, examining completed forms and records for evidence of compliance with documented processes. This comprehensive methodology ensures that the auditor gains a holistic view of the QMS, identifying both documented intent and actual execution, thereby fulfilling their responsibility to assess compliance and effectiveness. Question 12. Cost-benefit analysis shows that implementing a new, less expensive raw material supplier for a critical component in a life-sustaining medical device could save the company $5 million annually. As a certified biomedical auditor, what is the most appropriate next step in assessing this proposal? Option A. Proceed with the change, but only after the finance department confirms the projected cost savings are accurate. Option B. Initiate a comprehensive risk assessment to evaluate the impact of the new supplier on product performance, reliability, and patient safety, ensuring adherence to all relevant regulatory requirements and quality standards. Option C. Immediately approve the change to realize the significant cost savings, assuming the supplier's certifications are in order. Option D. Request a detailed report from the new supplier, outlining their manufacturing processes and quality control measures, without independent verification. The correct answer is B. Initiate a comprehensive risk assessment to evaluate the impact of the new supplier on product performance, reliability, and patient safety, ensuring adherence to all relevant regulatory requirements and quality standards. Explanation. This scenario is professionally challenging because it requires balancing the pursuit of efficiency and cost reduction with the fundamental ethical and regulatory obligation to ensure patient safety and product quality in the biomedical field. A certified biomedical auditor must navigate the inherent tension between financial pressures and the stringent requirements of regulatory bodies. Careful judgment is required to ensure that cost-saving measures do not compromise the integrity of the biomedical products or the processes used to develop and manufacture them, which directly impacts patient well-being. The correct approach involves a thorough risk assessment that prioritizes patient safety and regulatory compliance above all else, even when faced with compelling cost-benefit data. This approach aligns with the core principles of Six Sigma, particularly customer focus. The patient is the ultimate customer, and data-driven decision-making, where data must inform decisions that uphold quality and safety. Regulatory frameworks, such as those overseen by the U.S. Food and Drug Administration, FDA, for medical devices and pharmaceuticals, mandate that manufacturers implement robust quality management systems and risk management processes. These regulations require proactive identification, evaluation, and mitigation of risks associated with product design, manufacturing, and post-market surveillance. Therefore, any proposed process improvement, even one with apparent cost benefits, must be rigorously evaluated for its potential impact on product safety and efficacy, and must adhere to established risk management standards like ISO 14971. An incorrect approach that focuses solely on the cost savings without a comprehensive risk assessment fails to uphold the auditor's ethical duty and regulatory obligations. This approach disregards the potential for unintended consequences that could lead to product defects, patient harm, or regulatory noncompliance. Such a failure would violate the fundamental principles of quality management and risk mitigation expected of biomedical professionals. Another incorrect approach that blindly accepts the cost-benefit analysis without independent verification or critical evaluation of the underlying data and assumptions is also professionally unacceptable. This demonstrates a lack of due diligence and an abdication of the auditor's responsibility to ensure the accuracy and reliability of information used for decision-making. It bypasses the data-driven decision-making principle by accepting presented data at face value rather than scrutinizing it for potential biases or inaccuracies. A further incorrect approach that prioritizes the immediate financial benefits over long-term product integrity and patient trust undermines the core tenets of responsible biomedical auditing. This demonstrates a short-sighted perspective that can lead to significant reputational damage and legal repercussions for the organization, and a breach of ethical conduct for the auditor. The professional reasoning process for similar situations should involve a structured risk-based approach. First, clearly define the scope of the proposed change and its intended benefits, including the cost-benefit analysis. Second, conduct a comprehensive risk assessment, identifying potential hazards and failure modes associated with the proposed change, and evaluating their likelihood and severity. Third, determine if the proposed change introduces new risks or exacerbates existing ones that could impact patient safety or product quality. Fourth, consult relevant regulatory requirements and industry best practices to ensure the proposed change aligns with established standards. Fifth, if risks are identified, develop and implement appropriate mitigation strategies. Finally, document the entire process, including the rationale for decisions made, to ensure transparency and accountability. Question 13. Process analysis reveals that a regression analysis has identified a statistically significant relationship between ambient humidity levels and the accuracy of a specific diagnostic device's readings. The auditor is tasked with determining the most appropriate interpretation of this finding for regulatory compliance and patient safety. Which of the following interpretations best aligns with the certified biomedical auditor's responsibilities? Option A. The statistically significant relationship definitively proves that the device is faulty when humidity levels are elevated. Option B. The relationship is merely a statistical artifact and can be disregarded as it does not directly indicate a device malfunction. Option C. The identified relationship suggests a potential environmental factor that could impact device performance, requiring further investigation into operational procedures and device specifications to ensure consistent accuracy and patient safety. Option D. The finding should be ignored because the regression model's R-squared value is not exceptionally high, indicating a weak overall fit. The correct answer is C. The identified relationship suggests a potential environmental factor that could impact device performance, requiring further investigation into operational procedures and device specifications to ensure consistent accuracy and patient safety. Explanation. This scenario presents a professional challenge because it requires a biomedical auditor to interpret the results of a regression analysis in the context of regulatory compliance and patient safety, rather than solely focusing on statistical validity. The auditor must discern which interpretation aligns with the stringent requirements of the Certified Biomedical Auditor Framework, which prioritizes the identification and mitigation of risks that could impact the quality and safety of biomedical devices. The correct approach involves recognizing that regression analysis, in this context, is a tool to identify potential relationships that may indicate a deviation from expected performance or a risk to patient safety. The auditor must then evaluate these relationships against established regulatory standards and device specifications. This approach is correct because it directly addresses the auditor's mandate to ensure compliance and safety. Specifically, it aligns with the principles of risk management embedded in biomedical device regulations, which require proactive identification of factors that could lead to adverse events. The auditor's role is to translate statistical findings into actionable insights that uphold these regulatory obligations. An incorrect approach would be to dismiss a statistically significant relationship simply because it doesn't immediately suggest a direct device malfunction. This fails to acknowledge that indirect relationships or subtle trends identified through regression can still represent significant risks. For instance, a relationship between a specific environmental factor and a device parameter might not indicate a fault in the device itself, but could highlight an operational risk that needs to be managed to ensure consistent and safe performance. This approach is ethically and regulatorily flawed because it overlooks potential systemic risks that could compromise patient care. Another incorrect approach is to focus solely on the statistical significance of the regression model without considering the clinical or operational relevance of the identified relationships. While statistical significance is important, it is not the sole determinant of a finding's importance for a biomedical auditor. A statistically significant relationship might be trivial in practice or not directly related to patient safety. Conversely, A less statistically significant but clinically relevant finding could be more critical. This approach fails to meet the auditor's responsibility to assess the practical implications of data for device performance and patient well-being, potentially leading to missed opportunities for risk mitigation. A third incorrect approach is to interpret the regression analysis as a definitive causal link without further investigation. Regression analysis identifies associations, not necessarily causation. An auditor must understand this limitation and recommend further investigation to confirm causality before drawing conclusions about device defects or necessary corrective actions. Misinterpreting correlation as causation can lead to incorrect conclusions, wasted resources, and potentially ineffective interventions, thereby failing to uphold the rigorous standards of evidence-based auditing. The professional decision-making process for similar situations involves a systematic evaluation of statistical findings within the broader context of regulatory requirements, device intended use, and potential patient impact. Auditors should 1. Understand the purpose of the regression analysis in relation to the audit objectives. 2. Critically assess the statistical results, considering both significance and effect size. 3. Evaluate the clinical and operational relevance of any identified relationships. 4. Investigate potential causal links for significant findings. 5. Document all findings and recommendations clearly, referencing relevant regulations and standards. This structured approach ensures that statistical tools are used effectively to support the primary goal of ensuring the safety and efficacy of biomedical devices. Question 14. The risk matrix shows a significant increase in the likelihood and impact of non-conforming sterile processing procedures and device software validation failures. Given these findings and the limited audit resources available, which audit type should be prioritized to address these critical risks? Option A. Perform a general quality system review across all departments. Option B. Initiate a comprehensive supplier audit of all critical component manufacturers. Option C. Await a scheduled regulatory audit to address these identified issues. Option D. Conduct a targeted internal audit focusing on sterile processing and software validation processes. The correct answer is D. Conduct a targeted internal audit focusing on sterile processing and software validation processes. Explanation. This scenario is professionally challenging because it requires the certified biomedical auditor to balance competing demands and prioritize audit activities based on a dynamic risk assessment, rather than a static checklist. The auditor must interpret the risk matrix, understand the implications of identified risks for patient safety and regulatory compliance, and then strategically deploy limited audit resources. The challenge lies in moving beyond simply identifying risks to proactively and effectively mitigating them through appropriate audit types. The correct approach involves conducting a targeted internal audit focused on the high-risk areas identified in the matrix. This is the most appropriate strategy because internal audits are designed to assess the effectiveness of an organization's own processes and controls. By focusing on the specific high-risk areas, e.g., sterile processing, device software validation, the auditor can directly address the most critical vulnerabilities. This aligns with the principles of risk-based auditing, which is a cornerstone of regulatory compliance and patient safety. The regulatory framework for biomedical devices emphasizes proactive risk management and the establishment of robust quality management systems. An internal audit directly supports this by providing an independent evaluation of the organization's adherence to its own procedures and regulatory requirements in the areas posing the greatest threat. An incorrect approach would be to initiate a broad, unfocused supplier audit. While supplier quality is important, the risk matrix specifically highlights internal process failures. Diverting resources to an external supplier audit when the primary risks are internal would be an inefficient use of resources and would fail to address the most immediate threats to compliance and safety. This neglects the principle of prioritizing actions based on the highest identified risks. Another incorrect approach would be to solely rely on a regulatory audit. Regulatory audits are typically reactive, triggered by specific events or scheduled by the regulatory body. While essential for demonstrating compliance, they do not provide the proactive, in-depth internal assessment needed to identify and correct systemic issues before they escalate or are discovered by regulators. Waiting for a regulatory audit to address high-risk internal processes is a failure of proactive risk management and could lead to significant findings and penalties. A further incorrect approach would be to conduct a general quality system review without prioritizing the high-risk areas. While a general review might eventually touch upon the critical areas, it lacks the specificity and urgency required by the risk matrix. This approach is less efficient and may not provide the detailed insights needed to effectively mitigate the most significant risks in a timely manner. The professional reasoning process for this situation involves 1. Thoroughly analyzing the risk matrix to understand the nature and severity of identified risks. 2. Prioritizing audit activities based on the risk level, focusing on areas with the highest potential impact on patient safety and regulatory compliance. 3. Selecting the most appropriate audit type, internal, supplier, or regulatory, that can effectively address the prioritized risks. 4. Documenting the rationale for audit selection and execution. 5. Ensuring that audit findings lead to corrective and preventive actions that are effectively implemented and verified. Question 15. The monitoring system demonstrates a critical bug discovered during the final stages of user acceptance testing, which the development team claims can be addressed with a patch after deployment. But the validation documentation is incomplete regarding the full scope of the software development lifecycle testing performed. As a certified biomedical auditor, what is the most appropriate course of action to ensure regulatory compliance and patient safety? Option A. Reject the system for deployment until all software validation activities, including comprehensive testing and complete documentation, are finalized and reviewed. Option B. Approve the system for deployment with a formal commitment from the development team to issue a patch and complete the missing validation documentation within 30 days. Option C. Recommend a phased deployment of the system, allowing initial use with limited functionality while the remaining validation is completed. Option D. Approve the system for deployment, relying on the development team's assurance that the bug is minor and the patch will be deployed shortly, and deferring full documentation review. The correct answer is B. Approve the system for deployment with a formal commitment from the development team to issue a patch and complete the missing validation documentation within 30 days. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for a functional system with the long-term implications of compromising validation processes. The auditor must navigate the pressure to approve a system that is not fully validated, potentially impacting patient safety and regulatory compliance. Careful judgment is required to uphold the integrity of the auditing process and the quality of biomedical devices. The correct approach involves insisting on the completion of all required software validation activities, including thorough testing and documentation, before approving the system. This aligns with the fundamental principles of good manufacturing practices, GMP, and regulatory requirements for medical device software. Specifically, regulations such as those outlined by the U.S. Food and Drug Administration, FDA, under 21 CFR Part 820, Quality System Regulation, mandate that all processes, including software development and validation, must be established, documented, and followed to ensure that devices meet their intended use and quality standards. The software development lifecycle, SDLC, and rigorous testing are critical components of this validation, ensuring that the software functions as intended, is free from defects, and can be reliably used in a clinical setting. Ethically, the auditor has a responsibility to protect public health by ensuring that medical devices are safe and effective. An incorrect approach would be to approve the system based on incomplete testing, citing the urgency of deployment. This fails to meet regulatory requirements for validation and introduces significant risk. The ethical failure lies in prioritizing expediency over patient safety and regulatory compliance. Such an action could lead to device malfunction, patient harm, and severe regulatory penalties for the organization. Another incorrect approach would be to approve the system with a caveat that further testing will be conducted post-deployment, without a robust plan and commitment to address any identified issues promptly. While some post-market surveillance is standard, approving a system with known validation gaps before it is released to users is a circumvention of the validation process. This approach undermines the principle of designing in quality and safety from the outset and creates a reactive rather than proactive approach to risk management. A third incorrect approach would be to accept the vendor's assurance that the software is good enough, without independent verification, through the organization's validation process. This abdicates the auditor's responsibility to ensure compliance and relies on external assurances that may not be sufficient or may not align with the specific intended use of the software within the organization's context. It bypasses critical steps in the SDLC and testing phases that are designed to uncover potential issues specific to the intended use environment. The professional decision-making process for similar situations should involve a clear understanding of regulatory requirements, a commitment to ethical principles, and a systematic approach to risk assessment. Auditors should always prioritize patient safety and regulatory compliance. When faced with pressure to compromise, they should clearly articulate the risks and regulatory noncompliance associated with such shortcuts, document all discussions and decisions, and escalate concerns through appropriate channels if necessary. The focus should always be on ensuring that all validation activities are completed and documented to a satisfactory standard before a system is released for use. Question 16. The assessment process reveals that a new biomedical device development project is being initiated. The initial draft of the project charter broadly states the purpose as to improve patient outcomes, and the scope as encompassing all aspects of device design and manufacturing. The project objectives are listed as develop a user-friendly interface and ensure robust performance. What is the most appropriate next step for the certified biomedical auditor to ensure the project charter effectively defines the project's purpose, scope, and objectives in alignment with regulatory expectations? Option A. Propose that the project's purpose and scope be defined by the lead engineer, as they possess the most technical expertise regarding the device's functionality. Option B. Advise the project team to proceed with development based on the current charter, assuming that further details will be clarified as the project progresses through its life cycle. Option C. Suggests that the project team focus primarily on the technical aspects of the device, as the user-friendly interface and robust performance objectives are sufficient for guiding the development process. Option D. Recommend a detailed review of the draft project charter with key stakeholders to refine the project's purpose into specific, measurable benefits, clearly delineate the project's boundaries by defining what is in and out of scope, and establish SMART objectives that incorporate relevant regulatory compliance considerations. The correct answer is D. Recommend a detailed review of the draft project charter with key stakeholders to refine the project's purpose into specific, measurable benefits, clearly delineate the project's boundaries by defining what is in and out of scope, and establish SMART objectives that incorporate relevant regulatory compliance considerations. Explanation. The assessment process reveals a common challenge in project management, the initial development of a project charter. This phase is critical as it lays the foundation for the entire project, defining its purpose, scope, and objectives. A poorly defined charter can lead to scope creep, misaligned expectations, resource misallocation, and ultimately project failure. For a certified biomedical auditor, understanding and ensuring the robustness of this foundational document is paramount, as it directly impacts the quality, safety, and regulatory compliance of biomedical products and processes. The challenge lies in translating broad organizational goals into specific, measurable, achievable, relevant, and time-bound, SMART, objectives within the biomedical context, while also considering the unique regulatory landscape. The correct approach involves a collaborative effort to clearly articulate the project's purpose, define its boundaries, scope, and establish specific, measurable objectives. This includes identifying key stakeholders, understanding their needs and expectations, and documenting these in a way that is unambiguous and agreed upon. For a biomedical project, this also necessitates an early consideration of relevant regulatory requirements, e.g., FDA regulations, ISO standards, and quality management system principles. This ensures that the project is designed with compliance and patient safety as core tenets from inception. This approach aligns with good project management practices and the ethical responsibility of an auditor to ensure projects are initiated with a clear, compliant, and well-defined purpose. An incorrect approach would be to proceed with a vague or overly broad definition of the project's purpose and scope. This often stems from a lack of stakeholder engagement or an assumption that details will be worked out later. Such an approach creates significant risks of scope creep, where the project expands beyond its original intent, leading to budget overruns, schedule delays, and potential compromises in quality or safety. Furthermore, if regulatory requirements are not explicitly considered during charter development, the project may inadvertently deviate from compliance pathways, leading to significant remediation efforts or even product recalls. Another incorrect approach is to focus solely on technical objectives without adequately defining the project's business purpose or the intended benefits. This can result in a project that is technically sound, but fails to deliver strategic value or meet organizational needs. Professionals should adopt a structured decision-making process that prioritizes clarity, stakeholder alignment, and regulatory foresight during project charter development. This involves actively seeking input from all relevant parties, utilizing established project management methodologies, and conducting a thorough review to ensure all elements of the charter are well-defined, measurable, and aligned with organizational and regulatory expectations. Question 17. Investigation of a new diagnostic imaging modality for a hospital network has revealed a promising new technology from a single vendor that claims significant cost reductions and improved image resolution. However, the vendor has provided limited independent validation data, and the technology has not yet undergone extensive clinical trials in diverse patient populations. The hospital's procurement department is strongly advocating for this solution due to the projected cost savings. As the certified biomedical auditor, what is the most appropriate course of action? Option A. Recommend delaying the adoption of the new modality until comprehensive independent validation studies, robust clinical trial data demonstrating safety and efficacy across diverse patient groups, and full regulatory clearance e.g. FDA approval are obtained and thoroughly reviewed. Option B. Recommend adopting the new modality based on its perceived ease of integration into existing hospital workflows, assuming that any potential safety or efficacy issues can be addressed through post-implementation adjustments. Option C. Recommend adopting the new modality immediately, given the substantial projected cost savings and the vendor's assurances, to capitalize on the financial benefits for the hospital network. Option D. Recommend proceeding with the adoption of the new modality, but only after a superficial review of the vendor's provided data, prioritizing the procurement department's recommendation for cost reduction. The correct answer is A. Recommend delaying the adoption of the new modality until comprehensive independent validation studies, robust clinical trial data demonstrating safety and efficacy across diverse patient groups, and full regulatory clearance, e.g. FDA approval, are obtained and thoroughly reviewed. Explanation. This scenario presents a professional challenge for a certified biomedical auditor due to the inherent conflict between cost efficiency and patient safety, compounded by the pressure to adopt a new technology. The auditor must navigate the complex landscape of regulatory compliance, ethical obligations, and the practical implications of solution selection. The core difficulty lies in balancing the desire for innovation and potential cost savings with the absolute requirement to ensure that any chosen solution meets stringent safety and efficacy standards mandated by regulatory bodies. A hasty or biased selection process could lead to the adoption of a suboptimal or even unsafe technology, jeopardizing patient well-being and exposing the organization to significant legal and reputational risks. The correct approach involves a comprehensive, evidence-based evaluation of all potential solutions against predefined objective criteria that prioritize patient safety, regulatory compliance, and clinical effectiveness. This approach necessitates a thorough review of validation data, risk assessments, and alignment with established clinical guidelines. The justification for this approach stems directly from the fundamental principles of biomedical auditing and the regulatory framework governing medical devices and healthcare technologies, specifically adherence to regulations such as those enforced by the U.S. Food and Drug Administration, FDA, for medical devices, which mandate rigorous pre-market review and post-market surveillance to ensure safety and effectiveness, is paramount. Ethical considerations also dictate that the auditor's primary responsibility is to patient welfare, overriding purely financial or operational pressures. An incorrect approach would be to prioritize the solution recommended by a single, influential vendor without independent verification. This fails to meet the auditor's responsibility to conduct an objective and thorough assessment. Regulatory failure occurs because it bypasses the due diligence required to confirm the solution's compliance with applicable standards and its proven efficacy. Ethically, it represents a failure to act in the best interest of patients by relying on potentially biased information. Another incorrect approach is to select the solution that appears to offer the most immediate cost savings, irrespective of its validation status or potential impact on patient outcomes. This prioritizes financial considerations over patient safety and regulatory compliance, which is a direct contravention of the auditor's ethical and professional duties. Regulatory frameworks consistently emphasize that cost-effectiveness cannot be achieved at the expense of safety or efficacy. Finally, choosing a solution based on its perceived ease of integration into existing workflows, without a rigorous assessment of its clinical performance and safety profile, is also an unacceptable approach. While operational efficiency is a factor, it must be secondary to the primary requirements of patient safety and regulatory adherence. This approach risks overlooking critical performance gaps or safety concerns that could arise during actual clinical use, leading to potential patient harm and regulatory noncompliance. The professional decision-making process for similar situations should involve establishing a clear, objective set of evaluation criteria before reviewing any vendor proposals. This framework should include, but not be limited to, regulatory compliance, clinical validation data, risk management documentation, and alignment with organizational quality objectives. The auditor should then systematically assess each potential solution against these criteria, seeking independent verification of claims and engaging with clinical stakeholders to understand practical implications. Transparency and documentation of the entire evaluation process are crucial for accountability and to demonstrate adherence to best practices and regulatory requirements. Question 18. Stakeholder feedback indicates a recurring issue with a specific biomedical device's performance, leading to increased customer complaints. As a certified biomedical auditor, which approach to identifying the underlying causes of this problem best aligns with regulatory expectations for a robust root cause analysis, RCA. Option A. Prioritize the fastest possible resolution to minimize disruption, focusing on the most apparent cause without extensive investigation. Option B. Conduct a structured root cause analysis using a recognized methodology, such as a fishbone diagram or 5 whys, to systematically identify all contributing factors and their underlying causes, supported by objective data. Option C. Rely on the experience of long-term staff to identify the most probable cause based on past similar issues and implement a quick solution. Option D. Implement immediate, superficial fixes to the device's reported symptoms and document these as corrective actions. The correct answer is D. Implement immediate, superficial fixes to the device's reported symptoms and document these as corrective actions. Explanation. This scenario is professionally challenging because it requires a biomedical auditor to move beyond superficial problem identification to uncover the systemic issues that led to a recurring quality defect. The pressure to quickly resolve the issue, coupled with potential resource limitations, can tempt auditors to adopt less rigorous methods. Careful judgment is required to ensure the chosen root cause analysis, RCA, approach is thorough, compliant with regulatory expectations, and leads to sustainable corrective actions. The correct approach involves a systematic investigation using a structured RCA methodology, such as the 5 whys or fishbone diagram, to identify the underlying causes of the recurring defect. This approach is best professional practice because it aligns with the principles of quality management systems mandated by regulatory frameworks like the U.S. Food and Drug Administration's FDA Quality System Regulation, 21 CFR Part 820. Specifically, 21 CFR 820, 100, corrective and preventive action, requires that any adverse event or quality problem that is not corrected in such a way as to prevent recurrence shall be investigated. A structured RCA ensures that the investigation delves deep enough to identify the true root cause, rather than just addressing the immediate symptoms. This leads to effective corrective and preventive actions, COPPA, that prevent recurrence, a core regulatory expectation. An incorrect approach that focuses solely on immediate corrective actions, without investigating the underlying causes, fails to meet the regulatory requirement for preventing recurrence. This approach addresses the symptom, not the disease, and is likely to lead to the problem re-emerging, violating 21 CFR 820. 100. Another incorrect approach that relies on anecdotal evidence or assumptions without systematic data collection and analysis is also professionally unacceptable. Regulatory bodies expect objective evidence to support findings and corrective actions. This approach lacks the rigor required to identify true root causes and could lead to ineffective or even detrimental interventions, potentially violating the principles of good manufacturing practices, GMP, and the need for documented evidence. A third incorrect approach that prioritizes speed over thoroughness, perhaps by selecting the most obvious or easily identifiable cause, is also flawed. While efficiency is important, it must not compromise the integrity of the RCA process. Rushing the investigation can lead to overlooking critical contributing factors, resulting in an incomplete understanding of the problem and the implementation of superficial solutions that do not prevent recurrence. This undermines the purpose of the COPPA system and regulatory compliance. The professional decision-making process for similar situations should involve 1. Understanding the regulatory context and specific requirements for COPPA and problem investigation. 2. Selecting an appropriate and validated RCA methodology based on the complexity of the problem. 3. Ensuring adequate resources and expertise are allocated to the RCA. 4. Gathering objective data and evidence to support the investigation. 5. Documenting the entire RCA process, including findings, conclusions, and implemented actions. 6. Verifying the effectiveness of implemented corrective and preventive actions. Question 19. The assessment process reveals that for a critical medical device, the documented design inputs for a specific functional requirement are incomplete, with key performance parameters not explicitly defined. However, the design output specifications appear to address the intended function, and the device has passed its verification and validation testing. What is the most appropriate audit approach to address this discrepancy? Option A. Focus solely on the missing design input documentation and recommend immediate correction of the design input records to reflect the current device functionality, without evaluating the adequacy of the design outputs or validation. Option B. Conduct a thorough impact assessment to determine if the incomplete design inputs led to any unaddressed risks, or if the design outputs and subsequent testing adequately compensated for the missing information, documenting findings and recommending further investigation if necessary. Option C. Conclude that since the device passed verification and validation, the incomplete design inputs are not a significant issue and do not require further audit attention. Option D. Classify the finding as a minor documentation oversight and recommend a simple update to the design input documentation without further investigation into its impact on the design process or device performance. The correct answer is B. Conduct a thorough impact assessment to determine if the incomplete design inputs led to any unaddressed risks, or if the design outputs and subsequent testing adequately compensated for the missing information, documenting findings and recommending further investigation if necessary. Explanation. This scenario presents a common challenge in biomedical device auditing, ensuring that design controls are robustly implemented and documented to meet regulatory requirements, specifically within the U.S. framework for the Certified Biomedical Auditor exam. The challenge lies in discerning whether the observed deviation represents a minor procedural oversight or a systemic failure that could compromise device safety and effectiveness. Careful judgment is required to accurately assess the impact of the discrepancy and determine the appropriate audit response. The correct approach involves a thorough investigation into the root cause of the missing design input documentation and its potential impact on subsequent design stages. This includes evaluating whether the design output adequately reflects the intended function and performance, if design reviews identified this omission, and if verification and validation activities were sufficient to compensate for the missing input. Regulatory justification stems from the U.S. Food and Drug Administration's FDA Quality System Regulation, 21 CFR Part 820, particularly the Design Controls Section, 21 CFR 820-30. This regulation mandates that design inputs shall be documented and approved, and that the design process shall include provisions for design review, verification, validation, and transfer. A comprehensive impact assessment ensures compliance with these requirements by systematically evaluating the consequences of the identified deficiency. An incorrect approach would be to immediately classify the issue as a minor finding without further investigation. This fails to acknowledge the potential for a cascading effect where missing design inputs could lead to inadequately defined design outputs, flawed verification and validation, and ultimately, a non-conforming product. This approach violates the principle of thoroughness expected in regulatory audits and could lead to underreporting of significant risks. Another incorrect approach would be to focus solely on the missing documentation without assessing its impact on the actual device. While documentation is critical, the ultimate goal of design controls is to ensure a safe and effective device. Ignoring the potential for the device to be compromised, even with incomplete documentation, is a significant ethical and regulatory failure. This overlooks the purpose of design controls as a risk management tool. A third incorrect approach would be to recommend immediate corrective action without understanding the root cause or the extent of the problem. While corrective actions are necessary, they must be targeted and effective. Without a proper impact assessment, the proposed corrective actions might be misdirected, inefficient, or fail to address the underlying issue, leading to recurring problems and continued noncompliance. The professional decision-making process for similar situations should involve a systematic risk-based approach. First, identify the observed deviation. Second, gather all relevant documentation and evidence. Third, conduct interviews to understand the context and potential causes. Fourth, assess the impact of the deviation on the design process, the device itself, and patient safety. Fifth, determine the regulatory implications based on the identified impact. Finally, formulate an audit finding and recommendation that is accurate, specific, and actionable, ensuring it addresses the root cause and promotes compliance with relevant regulations. Question 20. When evaluating a deviation in a critical step of a biomedical device manufacturing process, where a specific parameter consistently falls outside its acceptable range, what is the most appropriate auditorial approach to understanding the sources of this process variation? Option A. Immediately attribute the variation to operator error and recommend retraining for all personnel involved in that manufacturing step. Option B. Focus on documenting the immediate impact of the deviation on the affected batch and recommending a rework procedure for that specific batch. Option C. Assume the variation is an isolated incident due to a temporary equipment glitch and recommend a one-time calibration check without further investigation into underlying process controls. Option D. Systematically investigate potential sources of variation by examining documented procedures, training records, environmental controls, and equipment calibration logs to identify the root cause. The correct answer is B. Focus on documenting the immediate impact of the deviation on the affected batch and recommending a rework procedure for that specific batch. Explanation. This scenario is professionally challenging because it requires an auditor to move beyond simply identifying deviations to understanding the root causes of process variation within a regulated biomedical environment. The pressure to quickly identify issues and the potential for significant patient safety implications necessitate a rigorous and systematic approach. The auditor must balance the need for thoroughness with the practical constraints of an audit. The correct approach involves systematically investigating potential sources of variation by examining documented procedures, training records, environmental controls, and equipment calibration logs. This method is correct because it aligns with the principles of good manufacturing practices, GMP, and good clinical practices, GCP, which mandate that processes be controlled and understood to ensure product quality and patient safety. Specifically, regulatory frameworks like the FDA's 21 CFR Part 820 Quality System Regulation require manufacturers to establish and maintain procedures for identifying, documenting, reviewing, and verifying corrective and preventive actions, CAPA, which inherently involves understanding process variation. By examining these specific areas, the auditor can pinpoint whether the variation stems from human error, equipment malfunction, environmental factors, or procedural deficiencies, thereby enabling effective CAPA. An incorrect approach that focuses solely on the immediate outcome of the variation, such as simply noting that a batch failed to meet specifications, is professionally unacceptable. This fails to address the underlying systemic issues that led to the variation, increasing the likelihood of recurrence. It bypasses the regulatory requirement to understand and control processes, which is a cornerstone of quality management systems. Another incorrect approach, which involves attributing the variation solely to operator error without further investigation, is also professionally unacceptable. While operator error can be a source of variation, It is often a symptom of deeper issues such as inadequate training, poorly designed procedures, or stressful working conditions. A responsible auditor must investigate these potential contributing factors rather than making a premature and potentially inaccurate judgment. This overlooks the systemic nature of quality management and the regulatory expectation to identify root causes. A third incorrect approach, which involves assuming that the variation is an isolated incident and not investigating further, is professionally unacceptable. Regulatory expectations, particularly under frameworks like ISO 13485, emphasize a proactive approach to quality and risk management. Ignoring potential trends or systemic issues can lead to significant compliance failures and patient harm. The professional reasoning process for similar situations should involve a structured approach. 1. Define the observed variation clearly. 2. Formulate hypotheses about potential root causes. 3. Systematically gather evidence to test these hypotheses, focusing on documented procedures, records, and direct observation. 4. Analyze the evidence to identify the most probable root cause. 5. Evaluate the impact of the variation and the identified root cause on product quality and patient safety. 6. Recommend specific, actionable corrective and preventive actions based on the root cause analysis. 7. Document the entire process thoroughly.